Hi, I'm Sunil Reddy, and I'm going to talk to you all about your upcoming shoulder replacement surgery. But before I delve into the various aspects of what goes on inside the operation theater, your subsequent recovery and rehabilitation, I'll briefly talk about the shoulder joint and what the components are made of. So the shoulder joint is a ball and socket joint. It's more like a big golf ball on a small tee, and it is held in place by the various ligaments and the important tendons called rotator cuff tendons that keep the shoulder joint in place and allow it to move through a full range of movement. When we do a shoulder replacement, as you can see, we can replace the ball with the ball and the socket with a plastic socket, something that is called anatomic shoulder. But for this shoulder replacement to work, we need all the rotator cuff tendons to work well. And unfortunately, that is not often the case because rotator cuff tears are very prevalent, especially once we are over 55 to 60 years of age, or it could be because of an injury, or once we wear out the socket and the bone. The wear is so big that it cannot be replaced just with an anatomic shoulder replacement. Hence, there is a different kind of shoulder replacement called the reverse shoulder replacement. As you can see, the ball has been placed where the socket was, and the socket is placed on the arm bone or the humerus. This shoulder replacement does not depend on the rotator cuff tendons to work as much. It rather depends only on the deltoid muscle to obtain movement and function. About 70% of shoulder replacements now being done in Australia are reverse shoulder replacements for this very reason. Most of the patients who undergo this replacement, once you're in the operation theater, you'll be seated in a position which we call the beach chair position. You'll receive a general anesthetic, and in most of the people, the anesthetist would administer a nerve block where an injection is given in the region above the shoulder, at the junction of the neck and the shoulder. And sometimes when you wake up, you may find that you have a small catheter or a tube there that is used to maintain the pain control over the first 24 to 48 hours. And this has been pivotal in making sure that shoulder replacements are no longer as painful. However, one side effect of this may be that you will find that your arm is numb and does not move. That is nothing to be worried about, because over the next 12 to 24 hours, you will start regaining your arm movements. When we perform the shoulder surgery, once the cut is made over the front of your shoulder, there is a tendon which is cut to access the shoulder joint. And once the shoulder replacement has been performed, the tendon is repaired back and you will be in a sling. The sling would remain in place for about 4 weeks usually, but this is variable depending on what was the reason the replacement was done in the first place. During these 4 weeks, I would strongly encourage you to remove the sling for a shower, remove the sling 3 to 5 times daily so that you can move your elbow, and using your other arm, you can move your shoulder as well. The physiotherapist will see you on the same day evening or the next day after surgery and go through the exercises. For the shoulder joint, it is very important that we start moving it as soon as possible. You may not be able to move it using your own muscles, but use the other muscles and move it passively, so to say, or in an assisted way, so to say. There have been a lot of advances in terms of the components, in terms of the reverse shoulder replacement, how we manage pain with nerve blocks, and how we manage the post-operative recovery and exercises. Once you spend about an hour to hour and a half in the recovery, you will go to the ward. Typically, most patients with shoulder replacements can go home in 2 days' time. The following day, you start doing your exercises, the block wears off, we make sure that you've got good pain medication on board. You can start walking, sitting out in a chair and using your other arm to perform as many of the activities as possible. Once you go home, our team will organize appointments for you initially on a weekly basis, but it is incumbent upon you to make sure that you remove the sling and perform the exercises 3 to 5 times daily. There are no sutures that would require removal because we use absorbable sutures, and you have a waterproof dressing, so you can have a shower on over the dressing. You can expect after the 4 weeks, once the sling has been removed, you can progress with movement and strengthening exercises and can expect improvements every week, and by 3 months you would be in a situation where you would be able to move the arm above the level of your shoulder. But for you to take it all the way up or take it to the back of your head or the back of your shoulder to dress and undress, this may take a much longer time. And patience is the key, and so is persisting with the exercise program. Next, we've spoken about the amount of pain control and all the benefits that you can derive from a shoulder replacement. But every surgery that we do, it is a trade-off between benefits and risks. For any surgery that we do on the shoulder or any other joint, it is a trade-off between benefits and risks. The benefits, of course, include that once you have completed the recovery process, you can have a pain-free shoulder with good movement and ability to lift weights and perform most activities at home or work. However, every surgery has its risks. We take all the risks very seriously. The first among them would be infection. Any joint replacement surgery where we place metal components in your joint, there is a 1 to 2% risk of infection. And infection in a shoulder replacement is a big deal. If you do get an infection, we will have to do more surgeries to clean out the infection and give you antibiotics over a prolonged period of time. In the worst case scenario, we have to remove the components and place a temporary cement spacer that is loaded with antibiotics to control the infection. And then we will have to come back in 2 to 3 months to remove that spacer and place a new component in. Secondly, when an operation is done on the shoulder, there are big blood vessels and a lot of nerves that are passing in front of and deep to the shoulder. And I am very aware of them and paranoid about protecting them. But there is a small risk of injury to these blood vessels and nerves that may be permanent, and that risk is about 1%. The other risks associated with any surgical procedure include chest infections, bladder infections, heart attacks following surgery, or blood clots. But the risk of blood clots with shoulder surgery is much less compared to hip and knee replacements, and we routinely tend not to use blood thinners after the procedure. Lastly, a percentage of people who undergo shoulder replacement can develop stiffness and pain in the long term. This is due to tightness and contractures of the ligaments and the capsule of the shoulder joint. The best way to try and prevent this is to start moving your shoulder as early as possible. But rarely, if this problem persists beyond the first 6 to 12 months, in a small percentage of people, more interventions may be required. Anytime that we do a shoulder replacement, there would be a percentage of people who may not like the result. The final result may not be what they would have expected prior to surgery, and this would have been in spite of our best efforts, and oftentimes the x-rays not showing any obvious problems. However, most people who undergo this surgery can expect excellent relief in pain, movement of the shoulder that may not be all the way up to where you have on the other shoulder, but a movement where you can surpass about 100 to 110 degrees, and ability to perform most activities without pain. There would be some permanent restrictions, which I will talk to you depending on what was the initial reason or the diagnosis for which the surgery is being performed.